And on matters health, persons living with albinism are decrying stigmatization during the COVID-19 pandemic. The group says when the first case was reported in the country, they were associated with the disease due to their color.
Meet Joyce Onyangi at her home in Nyansara village of Sengera in Kisii County. The 20-year-old is busy with her daily chores. She recalls how living with albinism has been an uphill task, especially during the COVID-19 pandemic. When the first case was confirmed in Kenya, she faced stigma with her peers and even neighbors associating her with the disease due to her complexion.
Nilipata challenges wakati nilisikia inaua watu kama sisi because we have low immunity. So, nikakaa na stress sana. Juu nilitengwa, watu wakanitoroka wenzangu, wakanitoroka even management wote wakanitoroka wakiniambia, msichana unastahili kurudi kwenyu, juu hii ugonjwa inaua watu kama nyinyi, unaweza kufia hapa na huko ni mbali.
Further, she faced stigma at school with the school management examining her before other students so that she could leave for home earlier.
Kufika kwetu, watu wananiambia umesikia watu wanakufanga kama nyinyi. So, wewe jirinde tu sana, usitoke kwa chua, usitengane na watu, unaweza waambukiza corona. Juu hiyo corona imekuja watu kama nyinyi, maybe ndio mko na hiyo shida, ama maybe ndio mmedevelop that hiyo ugonjwa.
Onyangi, who is the second child to be born with albinism in her family, narrates how they have had to face stigmatization owing to lack of information on the disease.
Shida social distance 1 meters away. Tukikaa kama kwa organization ama kwa church the way zimefunguliwa, uwezi ona mtu Kenya anafanya, although ni science inatumika sana. So mtu kutoka mbali uwezi muona. Ni lazima ufike karibu ndio muonane na yeye. Hiyo inakaa challenges kama sisi watu albinism hatuwezi ona.
According to Onyangi's friend Lydia Omoyo, who is also living with albinism, they need support to be understood by the society.
Nikiwa mtoto wa miaka 7 nilianza kuona dalili differences from my brothers and sisters. Baba mwenyewe hakuwa ananipenda. Kuona hivyo nikaona ni heri nisome kwa bidii ili nikuje kushinda my brothers kwa sababu mimi nimeona dalili, yani differences. Sasa nikafika class 8, sioni ubao, sioni chochote, but nimemaliza class 8. Sasa singeambia, hakuna mwenye ningeambia kwa sababu wazazi hawanioni kama mimi pia ningefanya kitu ya muhimu kwa that family.
Her mother, Sifia Kerubo, says COVID-19 has compounded challenges of bringing up children with albinism since they require sunscreen oil for their delicate skin and also need to eat well to boost their immunity.
Serikali inasema walemavu wanasaidiwa. Kwa nini wangu watasaidiwa? Hata majirani wanasema nimepata watoto au wasomi au wakuwa wa shule, wananichekelea. Mimi nimepata watoto wabaya, lakini nawaachia Mungu, ni Mungu alinipa hiyo watoto.
My appeal to the community is actually to give them they are not unable as such. Kindly support them. Do not stigmatize them. Do not keep the children, especially who are disabled, in their houses. They have the right to education. They have the right to other, health care.
Meanwhile, all public schools will have running water ahead of the reopening as part of the health measures to curb the spread of COVID-19. With less than 3 weeks to go before students return to class, the Ministry of Water has assured parents that provision of water had been addressed. According to the Chief Administrative Secretary in the ministry, Dr. Andrew Tuimur, they are working with donors to address the issue of water supply.
We don't know what the COVID issue would have done to us. So water is very critical, and now everybody knows that we require water. We provided a lot of water to the vulnerable areas, water boosters, water tanks.
We are also looking at the issue of supply of air. We know that in some instances the meter just reads, but no water is coming in. So we shall also regulate that. There will be obligations on these water providers. That one, they must make sure that water is provided. What they're billing for is what has been provided.
Nancy Okware, Channel 1 News.